All right, good afternoon or good morning, everyone, and thank you so much for joining our presentation today. My name is Sarah Curran. I am the Marketing Communication Specialist with Eurofins Scientific, and I will be here to facilitate our presentation today. Before we get started, I want to let everyone know that the webinar today is being recorded. A copy of these slides and the recorded video will be available to everyone who registered and attended within 48 hours after our live presentation, and we will have time for question and answer following the presentation. To ask questions of our presenters today, go ahead and use the GoToWebinar dashboard. On the right or left-hand side of your screen, there should be a box marked questions. In that box, you can simply type your question and hit enter. At the end of the presentation, we will pitch those questions to our presenters, and any unanswered questions will be followed up via email by the end of the week. So a little bit about Eurofins before we get started. Eurofins is driven by a mission to contribute to global health by offering high-quality testing, training, auditing, and consulting services. We strive to listen to our customers and not just meet but exceed expectations. We have a global footprint with over 35,000 staff in 400 laboratories around the world. We have a portfolio of over 150,000 analytical methods, and Eurofins provides a unique range of analytical testing to the pharmaceutical, food, environmental, and consumer products industries. To introduce our presenters today really quickly, we have Chris Hurd. Chris is a National Sales Manager with Eurofins DQCI. He is currently located in Fresno, California, helping launch a new DQCI laboratory that will be serving the Central Valley region. Dan Meyer is the Technical Director for the American Dairy Products Institute, otherwise known as ADPI. Dan is an expert in dairy product standards, including grade standards for dairy products and regulatory matters such as food labeling, food safety issues, and allergens. Gary Smith brings over 25 years of experience to his duties as Vice President of Eurofins Food Safety Systems. Gary has worked as a regulator, buyer, supplier, trainer, auditor, and has led both a certification body and a food safety standard. Without further ado, I will hand it over to Chris Hurd to introduce Eurofins DQCI briefly before we begin.
Okay, so Eurofins DQCI has been well known in the dairy industry for a long time. In fact, there are 2 lab locations specializing in dairy testing, with each one having over 75 years of quality testing experience. We're also extremely proud and excited to announce the opening of our brand new California location this week. The addition of this state-of-the-art dairy lab will provide additional support and improved service to the dairy industry in California and the West. DQCI is now well positioned to be a full coast-to-coast testing solution with our Centers of Excellence in Mountain View, Minnesota for the central United States, and in Horsham, Pennsylvania for the dairy customers on the East Coast. DQCI has one of the industry's most advanced and efficient wet chemistry dairy labs in the industry and can meet most any testing need in the dairy and dairy foods market segment. DQCI tests all dairy matrix samples, including fluid, natural, and flavored milks, creams, wheys, cheeses, cultured products, yogurt, butter, ice cream, and more. We are known worldwide for our calibration sample sets, including our capability to produce a wide range of custom standards. DQCI also has expertise in dairy producer testing and offers a range of herd health testing. Lastly, each DQCI location has a very close relationship and access on-site or within close proximity to a Eurofins microbiology lab.
All right, thank you so much, Chris. And without further ado, I will hand it over to Gary Smith to go through FSMA for all of us.
All right, well, thanks, Sarah, and thanks, everyone. Hope everyone's having a good morning or afternoon, depending on where you're at. We're going to spend just a few minutes talking about the Food Safety Modernization Act, or FSMA, and specifically, we want to talk about how it relates or how it impacts, it's going to impact the dairy industry. So what I want to talk to you about over the next few minutes is talk about, again, FSMA and all the different pieces of FSMA. We're going to be focusing this specific discussion on the preventive control rule, but I do want to real briefly let everyone know that there are a few additional rules in addition to the preventive control rule and how those might affect you. We're going to talk about the preventive control qualified individual. So that is a key term that is introduced in the rule, and everyone must have identified who that person is. So we'll talk about how one becomes a PCQI as well as what they need to be doing. Many of you probably have a HACCP or a food safety management plan in place already. Pasteurized milk ordinance kind of describes that pasteurization and what those processes have to happen is already in place. And with pasteurization as a CCP now in many HACCP plans, many times we get the question is, well, what's the difference between a food safety plan, which is required in the rule, and a HACCP plan? So I'm certainly hoping to answer those questions for you today, and then give you just a few examples of what preventive controls may look like for a typical dairy facility before I hand it over to Dan to talk a little bit more about specific implementation of the rule into the dairy industry. So again, just as a review for everybody to remember what FSMA is all about, or where it started. Remember 2011, President Obama talked about signed in the rule, the legislation, which at that time was legislation only and not a rule, basically gave the FDA the requirement to build a new Food Safety Modernization Act. It was designed to be preventive, detect and respond to food safety issues, and include provisions for dealing with the importation of food and food safety specifically. The Food Safety Modernization Act, as a brief review, covers everyone who's under FDA jurisdiction. Obviously, it doesn't cover meat products because here in the U.S., that's under the USDA, United States Department of Agriculture. So this is all FDA-governed facilities, jurisdiction of FDA. Some exemptions from the rule include folks, obviously, like the meat industry, alcoholic beverages, seafood, parts of it, as well as low-acid canned foods. Of course, the dairy industry is definitely impacted. And this is the largest change to legislation here in North America, certainly under the FDA, since the Food, Drug, and Cosmetic Act of 1938. So there are 7 parts to FSMA. A lot of folks and a lot of attention gets focused on the preventive control rule, which you see there highlighted as number 1. So we have current good manufacturing practice and hazard analysis and risk-based preventive controls. Sometimes people call that HARPC, although the FDA agency does not like that, but instead of our HACCP acronym. But we have the human food rule. We have the animal food rule, commonly called animal food rule. We have, it includes also good manufacturing practices and preventive controls. Produce, food safety. Number 4 there, you see foreign supplier verification program, and you notice that some of those rules are highlighted with an asterisk. Those asterisks means that those are applicable for the dairy industry. So definitely the preventive control rule is applicable for the dairy industry. Foreign supplier verification program, if you are bringing in product, importing product from overseas, ingredients, finished products, anything that's going to go into your product, then that rule would be applicable to you. The third-party certification recognition by FDA is really part of international audit verification. Number 6, intentional adulteration, sometimes called the food defense rule, as well as sanitary transportation. So certainly those 4 segments of those 7 rules can apply to the dairy industry, depending on, again, if you're using foreign suppliers, how you ship product, et cetera, et cetera. So an overview of the preventive control rule, sometimes called the PC rule. Again, this is, GMPs and preventive controls. So you see general provisions, that's definitions and whatnot. The rule really starts at subpart B, which is the current good manufacturing practices. We'll explore that a little bit more in just a second. Then we go to part C, which is where the preventive control pieces of it lie. And this is where we talk about, the hazard analysis and the building of preventive controls, the food safety plan, PCQI requirements, et cetera. Then we go to record requirements, and we'll detail some of those records. And then finally, Part G is supply chain. So this is not the foreign supplier verification piece. This is supply chain preventive control. And so we'll give some examples of that as well. So that's kind of how the rule is laid out. Again, note it's under CFR 21, Part 117. Now, some of you, I'm sure, are very familiar with the current dairy industry GMPs, which is actually under Part 110. If you're familiar with those, you'll notice that really, other than changing the numbering, not a lot has changed. Still the same 8 sections that you're used to, starting with personnel, plants and grounds, sanitary operations, etc. The major change, and I'm not going to get into too much of it, but the major change is now that cross-contact prevention is included in. So basically the handling of allergens. In Part 110, allergens were not a part of those GMPs. The handling, storage, etc. of allergens was not included. Of course, allergens we know is the #1 cause of recalls over the last 10 years or plus so. So obviously FDA was required or certainly wanted to ensure that the rule covered handling and storage and processing of allergens as part of their GMPs. So the main change to the GMPs from what you may be used to from the previous version or the current version for you, which is 110, is that again the FDA has added in cross-contact prevention. So the 8 sections here, again, equipment and utensils, processes, controls, warehouse and distribution, defect action levels. Again, those are the same that you're used to. The only major change here is that, again, the allergen management piece is added in, cross-contact prevention. Now, as far as the rule goes, as similarly as it is today, once September comes into play, so one of the things that we'll follow up with at the end, but just to introduce now, is that as you probably know, as Sarah said, you know, are you ready for September? The reason we're bringing up September of this year is that is when the implementation date for anyone under the PMO goes into effect. It is September 17th, I believe, officially. So the rule is in effect, and that includes the GMPs plus the preventive control piece plus the supplier control piece as well. So all those parts of the rule go into effect September of this year. You do not, you know, the main change for you in the GMP section, none of the GMPs have to be written. So that's the same requirement that you have now. So again, no documentation required for the GMPs. The only addition in the GMP section from what you're currently under is that everyone in the facility must undergo food safety and hygiene training at least once. And that's everyone in the facility, whether they work in the office or they drive a truck or they whatever. There has to be documented food safety and hygiene training on the GMPs for every employee, everyone in the facility, and you have to have that ready to go come September of 2018. So here's some additional training requirements that are part of the provision, and two main ones that it focuses on. The first one is talking about qualified individuals. Now, what is a qualified individual, and what's the difference between a preventive control qualified individual? Qualified individuals are basically anyone in the facility whom you give a responsibility to. So if you're saying you are the filler operator, or you're the pasteurizer operator, or you're the receiver in the warehouse, how are they qualified in order to do that task that you have assigned them? What education, what training or experience that is documented in order for them to be qualified to do what you've asked them to do. So everyone in the facility, essentially, who is around the food production area must be a qualified individual. So you have to have a system by which you show whoever it is in the facility, why are they qualified to do what you've asked them to do? Obviously, again, that's through training, that's through experience, that's through education. And then you see there on the screen that we've got to have the training in the food safety and hygiene records must be maintained. So there isn't an annual requirement. It's just that everybody has to have that training at least once. So definitely make it, one big training for everybody. And then as new employees come on board, make sure that that's part of their onboarding as well, that they have to have a food safety and hygiene training. Could be a video, could be a PowerPoint presentation, could be reviewing of your documented employee hygiene practices, and they sign that. You know, whatever it is for you to decide, that's up to you. You just need to have a record that everyone had been trained. And then the next piece, the big piece, or the other piece, is there must be at least one preventive control qualified individual identified for each facility. And there's two ways to become a PCQI. You can attend the preventive control training course, which is FDA recognized curriculum, or you can be qualified through job experience. Now, here's the definition of the PCQI from the rule, and it basically talks about completed training in the development and application of risk-based preventive controls, at least equivalent to that received under standardized curriculum, but recognized adequate by the FDA. So that training currently is the Food Safety Preventive Control Alliance. So you see the certificate there on the screen, the FSPCA. That is the only curriculum that satisfies that requirement as being adequate by the FDA. Now, you see the other part of that sentence that says, or is otherwise qualified through job experience. So what does that mean? And you might think that, well, I've been to a HACCP class, I've got 10 years experience in a dairy, running QA, surely I'm qualified. You're not. The agency has not defined any criteria by which someone can be qualified who doesn't attend a training class. So basically what that means is, to become a PCQI, you need a training certificate. We have asked them, you know, what if I've got 30 years experience and I've been through 12 HACCP classes? And they've said, no, you will not be qualified. So they essentially should just say, you have to take the training class, because essentially that's what they're saying. So definitely if you have not had someone or identified someone, now this person does not have to be a employee of your company. They can be a contractor, they can be a consultant, they can be anybody you want, but that you have to have a copy of their certificate available in your food safety plan for review by the FDA. Again, that's after September of this year. And these training classes are going on all over the place. FSPCA states that over 80,000 people have been trained so far to be PCQIs. It's a 2.5-day training class. Eurofins offers it. I'm sure there's been many dairy folks who have offered it as well. And if you need one, certainly we'd be happy to assist you. And we have plenty of them. We have them every month all over the United States. So we're happy to help you out with that. Now, what does the preventive control qualified individual have to do? This is right out of the rule. So the PCQI must prepare the food safety plan. We're going to talk more about the food safety plan in just a brief minute. But it must be that PCQI who builds the food safety plan. The PCQI must validate the process preventive controls, or you see in parentheses there, the CCPs. So if you've got a HACCP plan now and you've got CCPs in place, those are going to become your process preventive controls, and you must have documented validation as to how those controls affect or effectively control your hazard. So again, with the PMO, with pasteurization, that's already validation. You meet the 161 for 15 seconds, that's validation of your CCP. But if you have other CCPs in your HACCP plan today, as those become process preventive controls, you will need to have documented validation for those CCPs. Determination of validation is not required. There can be some justification by the PCQI. Again, obviously for dairies, it's going to say we don't need validation because we're under the PMO. That'll be easy for that CCP. Big one that a lot of folks are struggling with, review of records created from the food safety plan within 7 days of creation. So basically what that means is every monitoring record, every corrective action record, every verification record must have 2 signatures on it within 7 days of creation. They must have the person who took the measurement or the activity, the monitor, and they must have the PCQI or someone under their supervision must have a signature or initial on that record within 7 days of that record being created. And then the last piece or requirement of the PCQI is that they must analyze the food safety plan at least every 3 years. So you create it, and it must have been reviewed at least every 3 years. So no food safety plan can be more than 3 years old when an FDA individual comes to review it. So as I said, many of you probably have a HACCP plan. A lot of it probably comes right out of the PMO. You see a little difference there between HACCP and FSMA. Certainly the main part of that, and I think Dan is going to cover that a little bit as well, is that HACCP covers those process preventive controls, i.e. CCPs. FSMA goes a little bit beyond that, and some of the, what we call now prerequisite programs, actually will fall into preventive controls. And FSMA requires the 7-day record review, which HACCP requires record review, but you don't have a date on it. And the reassessment every 3 years. HACCP generally requires or recommends it to be every year. FSMA requires it to be at least every 3. So again, here is an example of what that transition from HACCP to FSMA can look like. So your process plan, which is now your HACCP plan, becomes your process preventive control. So that's easy. You don't even have to change anything. You can still call them CCPs. You can still call it a HACCP plan. It just goes right into your food safety plan, and you call it your process preventive control. You don't even need to call it your process preventive control. Just keep it HACCP. You're fine. Allergen management or allergen control plans. If you have allergens on site, you must build a preventive control, and that's going to go into your food safety plan under allergen preventive control. If you have allergens on site, you have to build a sanitation preventive control. That's going to come from your sanitation standard operating procedures now, or your SSOPs. Also, if you have a ready-to-eat facility, ready-to-eat product that you are packing in your facility, you will have to build sanitation preventive controls, and again, those come from your sanitation standard operating procedures. Supplier approval will now become your supplier preventive control if your hazard analysis describes that you've got a supplier who is applying a control of a hazard on your behalf. So if you've got, example, if you're getting pasteurized milk from someone else and you're making cottage cheese out of it or sour cream or something like that, because that individual is applying a control that controls the food safety hazards, biological hazards, you will have to have a supplier preventive control to ensure that they're meeting the rule. So that's part of that Part G that we talked about. And then anytime you have to have a food safety plan, you must have a recall preventive control, which for most of us right now is just their either product withdrawal or their recall written program. Again, some of the things that are changing in this now is that all of these programs, maybe were part of your customer requirements, or they maybe were part of your internal requirements. Maybe you had some of them written, maybe some of them weren't. Now they're all required. If you're, have those hazards in place, they must be documented and presented to FDA upon request. Preventive control management, we talked a little bit about that. Of course, now this all must be documented. We must have written procedures for the preventive controls, must have written monitoring, must have written corrective action, corrections, validation must be done by the PCQI of your CCPs, record review, again, within 7 days, calibration, and we'll talk a little bit more about testing here in just a second. And of course, we have to have a record of everything that we do.
But before we do that, I'm going to let Gary rest his vocal cords, and we're going to launch a polling question really quick for our audience. So just to get some insight from you guys, from our audience, we're going to ask, do you have a food safety plan with preventive controls developed already? Yes, no, in progress. We'll give everyone about a minute to read and respond. All right, we'll give everyone just a few more seconds to respond. We have about 75% of the audience participating. I know we can do better than that. All right. And I will close that poll and put the results up for everyone to take a look at. Lots of people still in progress, but we still have time. 60% of you guys are already prepared. That's great news. And 8% saying no. So there's still some information we're going to cover. And with that, we will proceed.
All right, thanks, Sarah. So basically 90 days left to go, and we've got about a third of us still have some work to do. So, all right. So one of the things that I talked about, sanitation preventive control. If you must have a sanitation preventive control, when do you have to? Well, the rule specifically states if a facility produces a ready-to-eat food and that ready-to-eat food is exposed to the environment and there's a risk for environmental contamination, two things have to happen. One, you have to have a sanitation preventive control, which documents essentially your sanitation cleaning procedures, plus your monitoring and verification procedures. Monitoring would be pre-op or something like that to make sure it's visually clean. But the rule specifically states that if you have a sanitation preventive control and you have that ready-to-eat food, you must include environmental monitoring in your verification activity. So this is the only time the rule basically says testing is required. So it doesn't require product testing, it requires environmental monitoring in that event when you have a ready-to-eat food and that ready-to-eat food is exposed to the environment and there's a risk of environmental contamination. So obviously in the dairy world, for us, that is Listeria. And so many of you do have a ready-to-eat food that is your final product. So I would imagine many of you are going to have environmental monitoring as part of a verification activity of your sanitation preventive control as a requirement. So the FDA will be expecting to see, and you can see there on the screen, what is required in that environmental monitoring program. It must be documented, and the rule basically says it must be scientifically valid. It must identify the test microorganism. Now, in the rule also, it states that the expectation is if there's a pathogen of interest, you will be targeting that pathogen. So obviously in the dairy world, that's Listeria. So again, we don't have to go to monocytogenes, but we certainly should be specifically looking for Listeria species in the environment. Now it doesn't define frequency, but it does define these specifics. Specify the locations for the samples to be collected with number of sites. Identify the timing and frequency for collecting samples. The test to be conducted. The laboratory conducting the testing. And include corrective action if and when you find a positive. So that must be documented per the rule for those folks who produce that ready-to-eat food and must have a sanitation verification activity. Now, product testing, as I said, the rule does not require it. It can be part of a supplier verification program if you've got that supplier preventive control. And if you do it, again, similar type requirements provided there. However, it is not mandatory. It is not mandatory. It is not expected to be part. If you say you're going to do it, then obviously you have to do it. But the FDA is not requiring product testing to be part of the rule. Real quickly here to finish up, records required. You know, again, this is new. So this is part of the regulation. A lot more record keeping requirements in place. Monitoring activities, verification activities, corrective actions taken. Records that document your supplier program, like approved suppliers and supplier verification, your training records for the food safety and hygiene, your records that you're a PCQI or a qualified auditor, your training records for your qualified individuals, and then, of course, any records that if you want to have justification to the rule. Real quick on the records themselves, they can be electronic or hard copy, must be accurate, legible, created at the time of the performance of the activity, have your facility identified, date and time of the activity, signature or initial of the person performing the activity, that's the monitor, right? And then identify the product or the lot, must be able to be retrieved within 24 hours. FDA, I've heard some early presentations from them on enforcement of the rule. They state a lot of times they're actually sending an email the day before they show up and say, we expect these records will be available when we get there tomorrow. So 24 hours, they can be stored off-site, but you must be able to get them within 24 hours. And again, food safety plan signed and dated upon completion, created by the PCQI, and records must be kept for 2 years. So record retention requirement of the rule is 2 years. The supply chain program, again, when your hazard analysis defines that you have to have a supplier preventive control, it must be documented, include on-site audits. You could use testing as a verification activity, but you must have some documented verification activity as well, and of course keep records for that as well. Now, what does it look like for a dairy implementation? Frequency of FDA inspections, we haven't gotten any specifics from the agency, but what they have said is they're going to define it on risk. If your products have had a history of foodborne illness, you'll be higher risk. If you've had a recall, you're certainly be higher risk. If you don't have a robust food safety program, i.e. SQF or BRC, if you have GFSI certification, they've told us you're going to go down on the risk level, but again, we don't know how much, and they haven't described that. So some examples of what I think would be preventive controls for dairies are going to be allergen preventive control. If you have, obviously, milk is an allergen. So if you've got milk in the facility, you're going to have an allergen preventive control documented, part of your food safety plan. If you've got an allergen preventive control, you're going to have a sanitation preventive control. If you have ready-to-eat foods in your facility, you're going to have a sanitation preventive control. And again, environmental monitoring will be required for that for ready-to-eat foods. And again, if you've got that supplier who is providing a pasteurization step for you of your process, you will have to build a supplier preventive control as well to deal with that if you're not additionally pasteurizing it yourself. If you're cooking it yourself, then you won't, but if you're relying on them to control that hazard for you through pasteurization and you're not doing anything else to address it, you will have to have a supplier preventive control for that. So just in summary real quick, again, the rule, human food rule, effective implementation starts September 2018. All dairies have to have that PCQI identified. Make the transition from your HACCP plans to those food safety plans. You've got 90 days. Other aspects of the FSMA could affect the dairy industry, such as foreign supplier verification programs, certainly sanitary transportation. Additional training for those may be required depending on what applies to you. So thanks for your attention very much. At that, I'll turn it back over to Sarah.
Yep, and before we transition over to Dan, I'm going to ask one more polling question related to one of Gary's later slides, and that is, has your site prepared for supplier verification activities? Similar to the last one, yes, no, or in progress. All right, just a couple more seconds, and I will let everybody get their response in. Okay. So I'll put those results back up on the screen. Similar to the last one, more people have their supplier verification activities in place, but more people also have not made any progress. So maybe that's because it's not relevant to you. We will find that out later. But first, I will hand it over to Dan Meyer from the American Dairy Products Institute. Dan, are you on the line?
Yes, thank you, Sarah. And thank you for that very good overview of FSMA, Gary. We appreciate that. I'm going to tell you a little bit about who ADPI is. Then I'm going to give you some feedback from the dairy industry as we get ready for FSMA in terms of some of the pros and cons of FSMA, as well as some frequently asked questions that the industry has received. For those of you who don't know, ADPI is the National Trade Association of the processed dairy products industry. We represent the manufacturers and marketers of dry dairy ingredients, and our mission is to seek to increase the worldwide use of dairy ingredients by marshaling the technical, manufacturing, and marketing resources of our members and others. Next slide. And here is just an overview of how we marshal our resources and how we're organized here at ADPI with our board of directors, all of our committees, and task force structure. Next slide, please. And one of our newest task forces right now is a dairy protein messaging task force. And there, with the big increase in the proteins on the emerging very frequently here, we are looking at initiating a marketing message program to promote the value of whey and milk protein. And we will be exhibiting IFT in July, where we'll be putting out the positive message about dairy proteins and how they are superior over the plant proteins. Next slide, please. And our vision at ADPI is to be the world's go-to authority on dairy ingredients. Just recently, we've completed standards on milk minerals, as well as a milk whey protein or a native whey protein. We're in the process of developing a standard on galacto-oligosaccharides, which hopefully we'll have completed here within the next few months. And as you can see in this slide, back in 2012, we had about 150 companies that belong to ADPI. Now with over 275 members, we're the leading association in terms of dry dairy ingredients. Next slide, please. This is just a chart showing our upcoming meetings and seminars. So those of you who are looking for more information on certain things, we have a dairy ingredient seminar in Santa Barbara, which will cover all the marketing aspects of all the dry dairy ingredients. On October, we'll have a technical symposium in Madison, Wisconsin, which will cover all the latest and greatest on research and what's going on from the technical standpoint. And then in November, we have a risk management seminar, which will be held in Chicago in conjunction with CME, and we'll cover everything on what to do with risk management in terms of the futures market, hedges, put options, all those things related to risk management. Then 2019, probably our most famous seminars, our annual meeting, which will be held in Chicago at the Marriott in May, and that attracts over 1,000 people who come there to conduct their business for the next 6 months, as well as you get information from seminars and what's going on with the latest markets. And then right after the annual meeting, we have a Dairy Ingredients 360 workshop, and that is geared towards people who are new to the dairy industry or who haven't been working in the dairy industry very long. We cover everything from the composition of dairy ingredients to pasteurization to some of the equipment to what's going on in the market, to give you a broad overview of what's going on from a dairy perspective for all these new employees. Next slide. So with that, I will talk about a little bit about FSMA, the Food Safety Modernization Act, and how it applies to dairy and how we see things coming up here in September. First off, Gary talked about the PCQI, and one thing that I think the dairy industry has done a great job of is that we have many industry out there that are trained for these FSMA audits. We realize the importance of FSMA. We also realize that people will be on vacation. People will miss out when auditors come by. So the dairy industry has made sure that they've had many people trained in these areas so they can cover an audit when the FDA inspectors show up. The second thing I'm going to talk about is picture taking. Hopefully everybody in your company already has a policy on picture taking. And for the most part, I would say, no, you shouldn't allow pictures to be taken, in your facility. However, there's exceptions to every rule, and there might be an instance where FDA comes in, they want to take a picture, and you're like, well, no, we don't allow pictures. However, over here in this little area right over here, yeah, we could take a picture of that. So that way it might help us in the future when we look at that and how we fix that problem in the future. Next slide. Here are some of the pros of FSMA from a dairy industry perspective. Number one, as Gary mentioned, the dairy industry is used to having a HACCP plan. And we're very, very good with the HACCP plan. We know what our critical control points are. We've done this for a long time. The dairy industry is very good at that. And basically, FSMA is kind of a glorified HACCP plan. It just takes those critical control points, turns them into preventive controls, and we validate and we verify, and then we can move on from there. Second, corrective actions are obviously a pro of FSMA because without corrective actions, if FDA just went out there and marked you up and you didn't follow up with corrective actions or what you're going to do with it, well, then it would just continue to be marked, and it could cause you to, be delisted or not be grade A anymore. So those corrective actions are very important in FSMA. And probably the thing that's probably one of the most important things on FSMA is it's more results oriented. As I said, with the validation and verification procedures, as well as the testing procedures, those are definitely very positive things for FSMA, and we'll make sure that the dairy industry follows through on things that they find in the plant. And then lastly, the environmental program. Gary touched on this a little bit as well, but when they go out in the plant, if they find an area where they think they're getting some positive for listeria or other pathogens, they're going to keep repeat testing of those pathogens that are positive until they can get those to be negative. And it might be on a product contact surface, it might be in an environmental area that is near the processing equipment. Next slide, please. And a couple of cons of FSMA. As much as the government thinks this is a pro, more record keeping is probably a con for FSMA. So, the dairy plants are there to basically run their plants, create the most safe product that they can for everybody in the world. So the last thing they want to do is create more records, within their plant. However, in FSMA, you're going to have to do that so you can show this to the inspectors as they come through looking at your plants. Another con of FSMA is that there's not many dairy experts left in FDA. I remember when I started back in 1990, we had, a dozen experts in FDA in the dairy arena. Now we're down to like 2 or 3, in the dairy area. So we're hoping that when FDA comes in your plant and they find a problem that they don't know a lot about, hopefully they will rely on some of their experts that are still left in FDA to bounce it off of them so they can come back and give you a reasonable reason or judgment as to why something was going on or why something was marked. Next slide, please. So with that, here's my contact information, and there's the ADPI website if you're interested in attending any of our educational forums. And with that, I will turn it over to Sarah.
All right, thank you, Dan. So we have one more polling question for our audience before we get into our question and answer. And related to both Gary and Dan's slides, we wanted to ask everyone to rate the effectiveness of their current record keeping program. So have you made the switch to meet the new FSMA requirements? And do you think that you are meeting those requirements? I'll give everybody just a few more seconds to vote. Okay, I will close that and share our results. So as you can see, people are fairly confident, but a lot of people in the middle of the road. So it sounds like there's still some questions that need to be answered. People would like some reassurance. And if you have any particular questions about that, you can ask them in the question box, because now we'll have time for some question and answer. So really quickly, I'm going to pull up the questions that have been submitted.
Looks like some folks may have felt that their chart recorders for their pasteurizers in good shape, but they may have some other record-keeping opportunities. So, got 90 days to get those records ready to go.
Yeah. All right. So earlier, someone asked, and this one is sort of a softball for you, Gary, but which dairy plants are exempt?
Any that aren't in the United States. So all that are in the United States are not exempt. So anyone who is in the United States is required to comply with the rule. Also, if you're a dairy outside the United States and you send product into the United States, you're required to comply with the rule. So fortunately or unfortunately, depending on your perspective, everyone who's in the dairy industry and under the pasteurized milk ordinance is required to comply with the rule.
Okay. One of our attendees with a great name, Sarah, asked, what documentation is required if we're relying on a customer to provide a kill step?
Okay, excellent question. So the customer is requiring a kill step. So there is a provision that in the rule that basically states once you've identified a hazard within your hazard analysis, there are 3 areas of the supply chain that can address it. Your supplier, and in case you have to build a supplier preventive control, you, in that case, you have to build a process preventive control or a CCP, or you can rely on your customer. Now, the rule's fairly specific. 2 things have to happen. 1, you have to identify that the product has not been processed to address that hazard. So basically, the marketing people love the fact that you basically have to label the product that says it still has pathogens in it, has not been treated. Secondly, you have to get an annual letter from your supplier or from your customer stating that they understand that the product you're sending them has an untreated hazard and that they have an effective food safety plan to address it. Now, you can only obtain that letter from a customer if that customer is under the rule. So, you know, we can't go down to our local Hy-Vee and basically make everybody fill out a form that says we have this sour cream and we think it's probably got listeria in it, so you got to sign this waiver before you can buy it and take it home. That won't work. So the written guarantee from the customer, only if the customer are covered under the rule, and it must be done annually, and you must identify that the product has not been properly treated to control the hazards.
All right. Here's a question that's a good one, but I think even I can answer this possibly. Is the formal PCQI training suggested / required, kind of based on the definition, for only dairy or for all other foods as well?
All other foods. Everyone under the rule is required to have an identified preventive control qualified individual. So all food manufacturing, human and animal food manufacturing facilities who are covered under the rule must have identified at least one PCQI. To get that PCQI, the really only way to get it is to attend that training class.
Yep. And I've actually taken that class with Gary as the instructor, and the curriculum does a great job of being malleable to the different industries that are attending the class. So, you know, if it's all milk people, then the class is geared towards that. But if it's more diverse in the industries we're attending, there's a lot of opportunity there to tailor it to the attendees at that particular PCQI class. Kristen has a question. If the only allergen in the facility was milk, why would you need an allergen preventive control?
Excellent question. You still have to have a preventive control program for allergens because you must have a label verification activity. So even if milk is in everything you do and you don't have to deal with the whole changeovers or sanitation or anything like that, in that case, if you're the food safety plan and you've got, let's say you're a fluid milk plant and milk is everything that you do and really the only thing that you do, you don't need a sanitation preventive control because we don't have a changeover for the allergen. But what you do still have to have is an allergen preventive control because you have to have a step or a mechanism or a process by which you verify that that product is accurately labeled to include the allergen. In this case, obviously, milk.
For supplier verification programs, what kind of suppliers are you referring to, Gary, when we went through that section? They want to know, are you just talking about milk, butter, or even preservatives, cultures?
All.
All.
And the challenging thing with, so anything that's going to go into the product is obviously a supplier, an ingredient supplier. So again, you have to look at it from, are there domestic suppliers who are applying a control that affects a hazard? We have to include those under supplier preventive control. Do we have international suppliers who are sending us ingredients that we're going to use in our product? Those have to be covered under the foreign supplier verification program. So it depends on what it is. Now, another thing to think about for suppliers, let's say you buy your product from a co-op, especially in the milk industry, and Dan may be able to speak to this a little bit as well. If your milk goes into a co-op and then you buy from that co-op, your co-op is not your supplier. The supplier of the product has to be someone who changes the nature of the product. So if you're bringing, raw milk into a central silo co-op, and then you buy your milk from that co-op is not your supplier. The supplier are the farmers who are supplying the co-op. So you would need to understand, if let's say they're pasteurizing it for you, you would need to understand who those unique farmers are, or producers, as it were, who are going into that co-op. And the co-op itself is not your supplier per the rule, because they're not changing the nature of the product.
Yeah, you bring up a good point there, Gary, too, because some people think, well, do these preventive controls apply to dairy farms? No, they don't really apply to dairy farms unless they're doing some on-farm manufacturing of the product there through a UF or something like that. They might be processing on the farm. Otherwise, the dairy farms aren't applied to that, but they do apply, like you said, through the co-op situation.
Yep.
All right. So probably just time for one or two more questions. I don't want to keep anyone on the line for too long. But in reference to the environmental monitoring program portion of this, what testing is required, and is testing required on the finished product?
Yes. No, finished product testing is not required per the rule. Environmental monitoring testing will be expected to be in place, again, when you are producing a ready-to-eat product, and there is a chance of environmental contamination from the time that you produce it to the time you put it in a package. Now, we know in many dairies, it's pipes, and then you've got a filler. So the question is, if you're making a sour cream, or if you're making a yogurt, and you're like, okay, everything's in a pipe, and then I go to my enclosed filler, would I have to have an environmental monitoring program in that case? And the answer is yes. Even though that, filler gap is extremely small, there is a chance for contamination. There has been contamination documented in the past in those types of products. It's a ready-to-eat product, so the expectation would be you have to have an environmental monitoring program in that case of the example of the dairy or sour cream, as I just mentioned, cottage cheese. Where the filler gap is very small, there's a filler head and then the product, and there's a very, very infinitesimal space there, but the agency has stated environmental monitoring is expected to be in place in a product such as that. Listeria is our target of interest. Listeria is the organ of interest, so you need to have a monitoring program designed around minimizing the risk of Listeria contamination. Now, the agency doesn't define frequency. They don't define test numbers. You could have a weekly program. You could have every other week. You could have a monthly program. The key is it documented? Is it statistically valid, scientifically valid? And does it meet the other parameters of the rule?
The only thing I would add to that is just because your FSMA doesn't require product testing for pathogens, you better check with your customer, because more than likely your customer will want pathogen testing on that product that you're making. Great
point, Dan. Yep.
All right. So I think we're going to wrap up a few minutes early here. Leftover questions will be answered directly by our presenters following the presentation. So look for those responses in your email if you have some unanswered questions in the queue. With that, I will thank Gary and Dan and Chris for their time today. Thank you to everyone who tuned in, and have a wonderful day, everybody.
Thank you, Sarah.